Hi there, this is an animated analogy to help you understand the actions of the extraocular muscles. When the eye is in primary position, which means when it's looking straight ahead, all the extraocular muscles are contracting together to keep the eye looking forward. To test a specific extraocular muscle, we need to know which eye positions allow for significant contraction of a given muscle. This is important when working out the causes of binocular diplopia. The medial rectus and lateral rectus are collectively known as the horizontal recti muscles, as they act in the horizontal plane. Their actions are very straightforward. If the eye is in primary position and you want to abduct the eye, you just need the lateral rectus to contract. If you want to adduct the eye, you just need medial rectus to contract. However, if the eye is in primary position and you want to look straight up, you need two muscles, the superior rectus and inferior oblique, to contract together. Vice versa, if you want to look straight down, you need the inferior rectus and superior oblique to contract together. These four muscles act in the vertical plane and are known as the vertically acting extraocular muscles. The reason why we need two muscles to look up or look down, but just one muscle to either look left or right, is because the eye lies laterally to the origin of the muscles. In primary position, the eye remains in the line of pull of the horizontal recti muscles, but not in the line of pull of the vertically acting extraocular muscles. This is also the reason why the vertically acting extraocular muscles have additional actions and why the horizontal recti muscles have no additional actions except to pull the eye in the horizontal plane. To illustrate the actions of the different vertically acting extraocular muscles, we will use the analogy as shown. Each two-gear set surrounded by the oval represents one eye. Imagine the perspective is that you are looking at the patient's face. We have a two-gear set representing the patient's left eye, which is seen on the right of the screen, and the patient's right eye, which is on the left of the screen. For simplicity, we will just focus on the patient's right eye. The two gears surrounded by the oval represents the patient's eye either in adduction or abduction, as shown by the position of the solid black circle representing the pupil. The medial gear represents the eye in the adducted position, where the eye is pulled medially due to the action of the medial rectus. The lateral gear represents the eye in the abducted position, where the eye is pulled laterally due to the action of the lateral rectus. The blue ropes with handles attached to the gears represent the main vertically acting extraocular muscles that are activated when the eye is either in the adducted or abducted position. The initials of the muscles are shown next to the main line of pull. This is not the same as the muscle's site of origin. The red line on the eyeball signifies the conjunctival vessels, which help us to see if there are any torsional movements such as intorsion or extorsion. Torsional movements of the eye are important to stabilize vision when the head is tilted in the coronal plane. Intorsion is where the top of the eye moves towards the nose. Extorsion is when the top of the eye moves away from the nose. When the eye is pulled by the medial rectus to the adducted position, the line of pull of the oblique muscles becomes ideal to influence vertical eye movement. If the superior oblique contracts, it causes the adducted eye to depress, as seen by the medial gear moving down. Also note that the superior oblique also causes intorsion of the abducted eye, seen by the red line on the lateral gear turning towards the midline. In the same adducted position, if inferior oblique contracts, it causes the adducted eye to elevate, as seen by the medial gear moving up. Also note that the inferior oblique also causes extorsion of the abducted eye, seen by the red line on the lateral gear turning away from the midline. When the eye is pulled by the lateral rectus to the abducted position, the line of pull of the vertical recti muscles becomes ideal to influence vertical movement. If the superior rectus contracts, it causes the abducted eye to elevate, as seen by the lateral gear moving up. Also note that the superior rectus also causes intorsion of the adducted eye, seen by the red line on the medial gear turning towards the midline. In the same abducted position, if inferior rectus contracts, it causes the abducted eye to depress, as seen by the lateral gear moving down. Also note that the inferior rectus also causes extorsion of the adducted eye, seen by the red line of the medial gear turning away from the midline. In summary, depending on your eye position in the horizontal plane, there will be a different action from the same vertically acting extraocular muscle. In the adducted position, the oblique muscles strongly influence the vertical eye movement. In the abducted position, The vertical recti muscles strongly influence vertical eye movement. Additional torsional actions occur in eye positions opposite to the line of pull of that muscle. For example, superior oblique has vertical action in the adducted position but torsional action in the abducted position.